Hello world, I'm here to walk you through the hematopoietic stem cell transplantation process, or HSCT. It can be life-changing and awesome. Here we go. This is the initial evaluation. First, you'll meet with your doctor and a research nurse to determine if you're a candidate. They'll go over risks, obtain informed consent, which is an important part of any procedure, to make sure that you understand the procedure and its risks, and then submit for insurance approval. Pre-transplant testing. Once approved by insurance, some more testing is probably performed to rule out any exclusion criteria to HSCT, obtain baseline data. You may see other specialty consultants as needed based on the findings from the tests you've taken so far. Mobilization Admission. One-night hospital stay to receive chemotherapy known as cyclophosphamide to prevent disease flare and prepare stem cells for collection. Yes, you may lose your hair here, or maybe just a little bit. Might be best to just shave it to make you more comfortable. Harvest preparation. You must remain in the center city until harvest is complete for GCSF or filgrastim injections, which helps to push the hematopoietic stem cells into your blood. The GCSF injections start 5 days after chemo until harvest day. These are easy self-injections. They really are. Don't be intimidated. Stem cell harvest. Outpatient stem cell harvest via apheresis machine 10 days after mobilization. Usually takes 1 day to complete collection and is done as an outpatient. Break. 2 to 4 week break before HSCT admission. It's okay to return home here. I didn't, because I just like being in the city where I was. But you're more than welcome to go home if you want, go to a wedding, whatever you want to do. You can even delay the procedure if you so choose. SCT admission. A PICC line is placed in your arm or your neck, depending on the size of the veins in your arm. The day before inpatient admission. You're admitted usually 5 to 6 days prior to stem cell transplant. We're getting close here, we're getting close. Your admission will be for about 2 weeks, and the first 4 or 5 days will be for your conditioning regimen. Conditioning regimen of chemotherapy and biologics to get rid of your old immune system. These vary by disease protocol, often given on days -6, -5, 4, 3, 2, 1, 0. Blast off with your HSC cells are given back to you. The day of stem cell infusion. Day 0 is your birthday of a new immune system. Stem cell transplant. Here we go. Day 0, stem cells are thawed and infused through your PICC line in the hospital room. This takes approximately 20 or 30 minutes. It's fairly anticlimactic. If you want, the cells can be blessed by your spiritual leader of choice. A lot of people do that. I did. This is a very big day. It's your new immune day. After that, post-transplant period, you have daily lab draws. For white blood cells, red blood cells, and platelets will decrease. Antibiotics, blood, and platelet transfusions as needed. Engraftment and discharge. Engraftment occurs usually on day 9 or 10. This is when cells begin renewing and the immune system recovers. You get discharged from the hospital then. Post-HSCT Care. Antiviral, antifungal, antibiotics in pill form. Monitor labs usually for 3 months. And there's a follow-up at the center at 6 months. Then yearly for 5 years. You did it. Now it's your body's job to do the work. This is truly a miracle of science. This field was developed by several physician scientists, including Dr. Richard Burt, who helped bring it from an idea in his mind to the bedside over 35 years of both research and patient care. Dr. Burt has perfected non-myeloablative conditioning regimens that are unique for each disease and have resulted in greater than 5-year-long drug-free remissions with improvement, no recurrence of any disease for relapsing remitting multiple sclerosis, chronic inflammatory demyelinating polyneuropathy, also known as CIDP, neuromyelitis optica, also known as Devick's disease, systemic sclerosis, commonly called scleroderma, and Crohn's disease. Using standard drugs, these diseases are chronic, so currently there's no definition of cure for these diseases. But here's the good news. HSCT, using disease-specific regimens, has converted these chronic diseases from slowly progressive drug-dependent chronic disease into an acute reversible illness, after which you are drug-free and symptom-free for more than 5 years in the majority of patients. It will take more time and more experience to see how long this return to normal lasts and some old damage from the chronic attack on your body before HSCT may still persist. After 35 years of research and 24/7 bedside care, Dr. Burt says that the future is to make HSCT safer, even making it safe enough to do as an outpatient procedure, and help to spread the knowledge of the technique to many centers worldwide so that you can go to your local hospital facility. Remember, autologous hematopoietic stem cells, HSC, are your own cells. You already own them. There is no patent or license or drug royalty and no drug companies involved.